As children's ICU specialists, many times when children and their families are admitted in the hospital, not only the physical illness but the mental impact of the whole illness is significantly high. Children and their parents go through a lot of stress, and that brings about sometimes delayed recovery, a more post-traumatic insult to the child, and a child fearing hospital for a lifetime. Child Life Services is an attempt to allay the fears of the child and the anxieties of the parents, to handhold them through this whole journey of hospitalization in the child. At the community level, many times in the current days, we have the family structure broken down. The yesteryear's joint family structure, which provided care, support, mentorship, and the eyes and ears for the child to grow, no longer exists, and digital devices have become unpaid babysitters. In this complex family environment, children today are not watched through their growing years. This results in a lot of behavioral issues, school performance which dips, social issues, and a tussle between the parents and the children, which manifests sometimes as health issues and mental health issues as well. To smoothen the journey between the parents and the child and this immediate environment, the child and the school, and to mainstream the child with a very positive outlook towards life, it is important that we have a team like Child Life Services which is able to guide them, guide the parents, and also educate the teachers as to how to handle these children. So both in hospital and out of hospital, when children have a physical ailment which is affecting their mental health, it's the Child Life Services which is able to help them.
In my day-to-day practice, we see a lot of parents coming with their children with varied problems, developmental issues, behavior issues. So when parents get to know that their children are going through such difficulties, it causes a lot of stress on them. Each parent reacts differently. When we are dealing with children, it is always not just children. We have to have the parents on board. And the outcome for these children are much better when this happens. This is where Ms. Sushma Gopalan comes in. She is doing a wonderful job. We see it in our day-to-day practice, the impact this has on the outcome of these children. We need the parents to be there, not just physically, but mentally as well. When they are there fully, they can give their best to their children, and we see the best outcomes. So this will really help in the long run.
Anytime our child is in the hospital, it's a daunting experience for the entire family. The child goes through mental trauma, and so does the family. It can be even for the smallest of the smallest. But hospital itself is a big scare. So as Child Life Services, what we do is bridge the gap between physical health and mental health. We always try to find the connection between the physical aspect and the mental aspect, but we never realize how interconnected they are. We as Child Life Services attempt to bridge that gap. So instead of giving mobile phones, instead of trying to distract your child, what we do is affirm their fears and try to help them come up with coping skills to manage that fear. And that's what we do.
Usually, a child is brought to the hospital and first either they visit OPD or the emergency. OPD is a common place of entry. Children do not come to the hospital by choice. But once they are brought, we as doctors and nurses primarily focus on the physical health and then counsel them. Whereas Child Life Services look into all the other emotional aspects. Children come with lot of negative emotions with them, like stress, anxiety, fear, helplessness, feeling of imprisonment. They have a lot of distress, other negative emotions. So these emotions also have to be handled along with treating the physical health issues. A child needs to be counseled. Many a times in the OPD, we do talk about the disease and then let them go. Whereas the child needs to know what is happening to him or her, whether it is a toddler or an adolescent. They need to know what they are going through. They need some counseling. So child life therapist does connect with the child as well as the parents, relieve their anxiety. So it's always better to have child life therapist who can help to have a better experience in the hospital for both the family as well as the child.
As part of my regular job, I assess children with a lot of neurodevelopmental disabilities such as autism and learning difficulties. In the process, we find that a lot of the children have emotional and behavioral difficulties, a lot of fears, a lot of low confidence, low self-esteem, and some of the clinical conditions such as anxiety and depression as well. We refer these families to Ms. Sushma Gopalan and the Child Life Services team, who then take care of the families with their long-term support.
The type of patients we treat are children with cancers or children undergoing bone marrow transplant. Whenever a child gets diagnosed with transplant or undergoing serious medical treatment, it puts the stress on the child as well as the entire family. An integrated medical care has to address all parts of the problem, including the psychological well-being of the child and the family. So in providing the psychological support for the child and the family, the Child Life Services has been doing an excellent job and helped many families cope with difficult situations. So the support provided by the Child Life Services makes a difficult journey bearable and give comforts to the families so that they can deal with the situation in much better way.
Child Life Services at Aster Family is a boon. They have assisted our Aster family members by conducting several enormous workshops and also having one-on-one psychological supports, motivating and strengthening our mindset and tuning us in every aspect, ensuring a balanced, peaceful work environment. Thanks to Sushma and team.
For me, Child Life Services is love, and it has helped me discover the child within myself.
I was actually guided by one of my pediatricians to Aster to meet Dr. Ravi Kumar for the developmental delay in my child. And Dr. Ravi Kumar explained me in detail regarding the ASD, but I was running myself very low for the personal reasons, and I was guided to Dr. Sushma. And after the interaction, close to a month, I can clearly say that I was able to think clearly and move on in my life. So a big thanks to Aster and Dr. Sushma.